is the fourth most common mental illness, and it can affect anybody: men, women, children, adults, people of all cultures and all races. But what is OCD?
Hello everyone, Kausa Praveen is here. I'm going to talk about OCD today. OCD is obsessive compulsive disorder, generally known as OCD, which is a mental health condition which is affecting so many of us, 1 out of 3 in a modern age, because of mechanical life, because of lack of nature in our daily routines. OCD is generally known a mental health condition. As I said, it happens when a person experiences or repeats the unwanted thoughts, obsessions, and feels the need to perform it repeatedly. These behaviors are called compulsions, which reduce anxiety. In simple word, I would say OCD is when your mind gets stuck on worrying thoughts, getting obsessive about things, and you feel you must repeat the certain rituals to feel calm and safe, relax. The OCD cycle as follows: obsessions and unwanted, distressing thoughts. Secondly, distressness, anxiety, or fear caused by those thoughts. And then compulsion come. Compulsions are repeating or are repeated action done to reduce the anxiety. There then you get temporary relief, but the cycle start again. So from here you know how it goes and control a person's life and their daily routine. OCD can interrupt a person's daily life to the extent it causes mental and physical exhaustion. OCD is very common, as I said at start. Please explore, and hopefully you will like this topic, because many of us, without knowing, are repeating in a modern life. So many things are getting obsessed about or repeating in our daily lives without knowing if this is a mental health condition. So please do explore. Thank you very much for listening.
Hi everyone, my name is Elvina. I am a student at University of Suffolk. Today I will discuss about the diagnosis and treatment of OCD. There are two main diagnostic criteria. Number 1 is psychological assessment. Number 2 is physical examination. So in psychological assessment, the physician should determine whether the patient has compulsive behaviors or obsessions that may impact his daily quality of the life, his thoughts. The physician should discuss his thoughts, his feelings, and his behavioral pattern. Talking with the patient's family members and friends is also part of this, but with the consent of the patient. So in physical examination is done to see any consequences which are happening due to the symptoms patient is suffering. So diagnosing OCD can be a challenging due to OCD resembles to schizophrenia, anxiety disorders, depression, obsessive compulsive personality disorders, and mental illness. So the physician should diagnose it carefully. So in treatment includes, number 1 is cognitive behavioral therapy, number 2 is medication, and number 3 is deep brain stimulation, which is a type of surgery. So in cognitive behavioral therapy, therapist needs to break down patient's problem into various parts, such as his ideas, his physical feelings and actions, and encourage the patient to face his concerns, experience obsessive thoughts without neutralizing them with compulsive activities. So mild OCD patient may need 8 to 20 sessions, and patient who are more severe, it depends on their severity of the disease. So medication include antidepressant, selective serotonin reuptake inhibitors, which are include fluoxetine, fluvoxamine, paroxetine, sertraline, and clomipramine. Side effects also include with the medication, restlessness, nervous disturbance of sexual activities, constipated, and diarrhea. And in the last, deep brain stimulation. So this involves implanting electrodes with certain areas of the brain. These electrodes generate electrical impulse that could aid in regulation of abnormal impulses. So in conclusion, I will conclude that OCD is a complicated and cripple mental illness, genetic and neurological and environmental variables are its etiology. Medication, cognitive behavioral therapy is the treatment, and the patient can be cured and improve his quality of life with support and treatment and interventions. So this is the end of my topic. Thank you so much.
Hi everyone, my name is Aline Munezero and I'm going to talk about care and support for people with OCD at home. Helping people with OCD at home requires a balance of empathy, patience, consistency, and it involves supportive and no judgmental environment while avoiding enabling their compulsions. The primary goal here is to provide an emotional support that includes encouraging professional treatment like cognitive behavior treatment. First, gently stopping the inebriament of OCD rituals. This phase requires a compassionate approach that helps to keep the peace of mind, typically using exposure and response prevention principles. Here, the main goal is reducing the participation in rituals, which could increase the anxiety. Second, providing an emotional support. Supporting people with OCD requires also a balance of patience, compassion, kindness, and it's better when you set some boundaries together for motivating recovery rather than enabling the cycle of compulsions. Third, encouraging professional help. This fundamental step requires the most ineffective approach, educating yourself about the health condition and kindly stop assisting with rituals. The main key is to suggest a special therapy, which is an exposure and response prevention. Fourth, creating a collaborative household rules. It could be better to define the zones, times, and agreed on specific area of the house that are not part of the rituals and choose the quiet hours or downtime where OCD conversations are paused. Fifth, seeking partner support from different charities or organizations which support people with OCD in the UK. Thank you.
Hi, good morning. My name is Hina Khan, and today's our topic OCD, which is my friend mentioned it. Today I'm going to talk about the OCD symptoms. There is a lot of OCD symptoms, but today I'm going to mention it a few of them, which are unwanted thoughts, images or argues enters in mind, fear of pollution and dirt, too much hand washing, showering or cleaning household items, checking door locks repeatedly, unwanted thoughts and difficult to control, thinking about forgetting something to do, like door locks, gas or house keys, aggressive or horrific thoughts about losing control. Stay away from people. And I'm going to talk about the OCD daily affect lives. According NHS, obsessive compulsive disorder OCD is a mental health condition which can affect a person's daily life. It is very hard to spend each day with unwanted thoughts, repeated behaviors, or mental rituals that are difficult to control. Sorry. OCD can affect easily on personal relationships. For example, family, friends, or
Hi, my name is Nabila Ruhi. I am the student of Suffolk University of London, studying social and healthcare education. My topic is causes of OCD. The exact cause of OCD is unknown, although several ideas exist. A person may develop the disease as a result of the following factors. Number 1, individual. Experience life occurrence like trauma, abuse, neglect, or loss. Number 2, biological. Some people have abnormally active brain region. Number 3, genetic. If a family member has OCD, you are more likely to get it yourself. Number 4, personality. OCD may be more common among those with high standards who are systematic and careful, who have a strong sense of duty, or who are typically highly worried. Cause of obsessive compulsive disorder. Though there are no clear reasons, researchers believe there are several theories as to how OCD can develop. As with many mental health conditions, OCD is likely to be caused by a common combination of factors. These include brain function. According to research, individuals with OCD display subcortical brain structures and abnormal frontal cortex connections, which result in altered behaviors. Transforming mental health 2016, biological factors and OCD. According to certain ideas, OCD might be brought on by medical issues with our brain or body. These are referred to as biological factors. According to some biological ideas, OCD may be related to a deficiency of the brain neurotransmitter serotonin. It's unclear thought if this is.
Good day, everyone. My name is Haray Jasapal. For today, I would like to discuss the topic about the 7 types of OCD, which is under mental health condition. The first type of OCD is contamination or mental contamination. This is characterized by the intense of fear of dirt, germs, and also bodily fluids. This is often engaged in excessive or severe washing or showering, and also cleaning surfaces deeply just to make sure the surroundings is safe from any contamination. They also avoid touching materials from public places or within the public places. Number 2 is checking OCD. This involves fear of causing harm to oneself or others. This type of OCD have always fear of danger that resulted to a compulsive checking, like checking of lock of the doors, checking appliances to make sure that they are properly switched off. They also avoid sharp objects for fear of losing control to harm other or because of harm responsibility. Number 3 is symmetric or ordering OCD. This is a kind of OCD that urgently needs material to be just right, aligned or balanced. Or in other words, this is driven by the needs of an object to be organized in a precise, orderly, and symmetrical manner. This includes counting, organizing the same items over and over again just to make sure that they reach a certain standard, which they feel happy and contented. So this kind of OCD may be similar to people who is perfectionist. Number 4 is rumination or intrusive thoughts. This is including like purely obsessional OCD. It's a persistent, unwanted, distressing thoughts that causes from sexual violence, especially to children, and also sexual images that causes mental rituals, often misunderstood. Number 5 is hoarding. This is a kind of OCD that have an obsessive fear of losing important materials or items, and also have a compulsive needs to acquire discarding items. So this type of OCD causes distress and clutters. Number 6 is relationship OCD, or they call it ROCD. It is an obsession of doubts about the suitability of a relationship of a partner that leads to a reassurance-seeking behavior, or this is a constant doubt-filled thoughts about the validity and quality of one's romantic relationship. So number 7 is scrupulosity. This type of OCD have an extreme anxiety about offending a higher power, blasphemy, of acting immorally, and violent thoughts resulting in a prayer or confession rituals, which often used to manage anxiety. So that's all my topic. Thank you so much.
Hi everyone, my name is Elvina. I'm one of the students at University of Suffolk. Today I will talk about the prevalence of OCD. So the name OCD did not come into being until 20th century, but prior to the earlier references to the symptoms what we would call obsessive compulsive disorder were called on that time scrupulosity. Much more earlier historical record shows that it was related to the religious rather than the medical literature. So what is clear from many cases that from 14th century to the 18th century, obsessional fear around religion were commonplace. So based on current estimates for the UK population, there are around 750,000 people are affected with OCD at one time. So what we know about OCD is that condition affects as many as 12 in every 1,000 people. It means 1.2% of population from young to adults regardless of gender, social or cultural background. So recent research suggests that OCD is slightly more prevalent in women than in men. OCD starts to become problematic and impacting on a person's life on average during late adolescence in men and during their 20s in women, although the age of onset cover a wide range of ages with development of the disorder for some children in 6 and 25% of cases started by age 14. Onset of after the age of 35 is unusual but does occur. The reason people have misconception that OCD is more common now because of the traditional media and social media now making much more references to OCD, sadly often